Hello and welcome to our January on Target. My name is Carrie Racian, and I'm the director of the UConn Arms Center and associate professor of public policy here at UConn. So UConn Arms hosts on Target about once a month. They vary in day, but we can try to keep the time the same, 12 to 1 p.m. Eastern, and we hope that these seminars provide an opportunity for dissemination and discussion of emerging research. The seminar is open to all researchers, policymakers, practitioners, and really anyone who wants to know more about the research in this field. I think that's more important now more than ever. So in the future, when you get these links, if you want to disseminate them amongst your networks, please feel free to do so. This is meant to be an open seminar to really, again, disseminate research, and that only works if people get the email and are able to attend. If you would like to present your research at an upcoming On Target, please get in touch with us. We will drop our email in the chat a little bit later once a few more people get on, since they can't see the chat if they're not here. And again, we welcome presentations from any discipline. And our next seminar will be on Tuesday, February 11th, and we'll feature Dr. David Yamane, who is a sociologist. But today, I'm excited to welcome Dr. April Zeoli. Dr. Zeoli is an associate professor of health management and policy and the policy core director at the Institute for Firearm Injury Prevention at the School of Public Health at the University of Michigan. That is a lot, but she's fantastic, so she deserves it. I know Dr. Zeoli best for her work on domestic violence restraining orders, which are pretty related, but distinct from what she'll talk about today. And so I'm really delighted that she has started researching in the area of ERPOs, sometimes called extreme risk protective orders, sometimes called red flag laws. And she'll tell us much more. And in fact, today her presentation is Extreme Risk Protection Orders, the State of Science. The way today will proceed, Dr. Zeoli will present for about 35 minutes. We ask that you only interrupt if you'd like to have a really just very urgent clarifying question, and we will all be utterly confused without you asking this very important question. Should you not be brave enough to do that, you can always put it in the chat. We'll be monitoring the chat, and so we can filter that as well. After the 35-ish minutes, we'll open it up for questions, discussion, conversation, whatever that looks like. We'll be excited for. So I'm going to turn it over to Dr. Zeoli. Go for it, April.
Thank you, Carrie. So I do have slides, so let me just get these up. Slideshow. Okay. I realize I told Carrie this was going to be weird and awkward when I did it. It is.
She said she was committed though, so
yeah, I am committed. So you're going to see my screen background for a second while I get this up. That's Gaël Monfils.
Fantastic. I love it.
Okay. So I'm going to talk about extreme risk protection orders. I'm going to call them ERPOs, and the research that we have on them right now. But first, a word on policy and policy research. Policies take time. Interventions take time to show an effect. And when you have something like an extreme risk protection order law, it takes time for it to be implemented, for it to be used, for people to understand how to use it. So we don't expect there to be big effects right away. So anybody, who's really interested in outcomes research, does it reduce mass shootings? Does it reduce homicides? We're not really there yet in the research. We have some evidence around suicides, which I'll present towards the end. But otherwise, a lot of this is descriptive. So extreme risk protection orders, for those who, don't fully know what they are, these are court-issued civil orders that temporarily prohibit the purchase and possession of guns by those at imminent risk, immediate risk, high risk. Each law says something slightly different, of harming themselves or others. So these are civil actions. They don't necessarily involve police officers. They don't necessarily involve criminal courts. In some states, only police officers can petition for these orders. And in some states, civilians can petition, civilians being family members, friends. I'm sorry, not friends, but healthcare workers. And in some states, they're actually processed through a criminal court, even though they're civil orders. And in other states, they're fully processed through civil courts. But they are civil orders. They do not, in and of themselves, generate a criminal history. And they're used for all kinds of risk of harm, risk of self-harm or suicide, interpersonal violence, including everything that falls under that, intimate partner, family violence, street violence, violence against neighbors. And they're also used for mass violence and school violence, which is kind of a subset of interpersonal violence. Now, right now, 21 states, the District of Columbia, and the US Virgin Islands has an extreme risk protection order law. And you can see on this map, the states that are in yellow have extreme risk protection or ERPO laws. And you can see that there's, quite a bit of geographic clustering of states with these laws. We have the West Coast, we have some of the Midwest, Michigan, Indiana, Illinois, Minnesota, and we have this swath on the East Coast. And then Florida, New Mexico, Colorado are kind of hanging out by themselves. But we do see that these are around the country. The first state to pass an extreme risk protection order like law was Connecticut in the late 1990s. And then Indiana followed around 2005. But then we didn't see any other states pass an extreme risk protection order law until Colorado. They enacted theirs in around 2015, and they called theirs something totally different, a gun violence restraining order. And then after some high-profile mass shootings, particularly the one in Parkland, Florida, at Marjory Stoneman Douglas High School, we saw a bunch of states pass these laws pretty quickly. So that's when we got Florida and a bunch of others of these states. And then recently, Michigan and Minnesota have come online with ERPO laws in response in Michigan to a school shooting we had at Oxford High School. And I'm not sure what the big motivation behind Minnesota was. So these laws tend to pass when there are policy windows of opportunity, when people are thinking about gun violence and preventing gun violence. And mass shootings are generally the impetus behind that, but they're used for all types of gun violence. So, like I said a minute ago, interventions take time to be implemented and produce an effect. And then research takes time. We have to find the funding, then we have to collect the data, which in the case of ERPOs means getting a lot of documents from the court. And when I say a lot, I mean a lot of documents around the ERPO case files from the court, abstracting it, analyzing it, and then publishing, which can take a whole nother year. So we don't have a lot of outcomes research, which we will start getting that. There are a lot of projects in the field right now. And not all research produces equally valid results. So there's some research that's out there that I'm not going to present today because I don't trust it. Some of these projects showed that ERPOs are incredibly effective, wildly effective, more effective than they could actually possibly be. So I'm going to focus on what is scientifically valid. There are public opinion polls out there, scientific public opinion polls, done by Johns Hopkins and done by some other organizations that have shown that the public really is in favor of ERPOs. Now, some of that research focuses on whether someone would petition themselves for a loved one to be under an extremist protection order so that they didn't harm themselves or others, instead of whether they wanted a law enforcement officer to do that. So it's a little caveat on some of the research, but generally, these are incredibly popular laws. Um, you can see here at least 70% of the public supports ERPOs. And that really goes across the board. There's only slight variations when we look at different affinity groups, gun owners, non-gun owners, NRA members, non-NRA members, Republicans, Democrats. Um, and the stat that I have here is that 79% of firearm owners favor it and 89% of non-firearm owners favor it, which, yeah, is a difference. But 79% of gun owners favoring it means that this is incredibly acceptable. So they are very popular, even though you will hear some concerns about their use. And we'll talk about that more towards the end. What we know about their use is that it varies incredibly. Now, I give statistics here from Florida and Connecticut, which are two different population size states. It's the time trend, not time trend, but the time period that you should pay attention to. From 2018 through June 2020, Florida had 4,695 ERPO petitions. Right now, Florida is almost around 20,000. Connecticut, because where you are, from 2013 to June 2020 had 1,406. And even though Connecticut had this law since the late 1990s, before 2013, it wasn't really used, very much at all, a couple hundred cases. Even within states, we see large variations in use. So despite the 4,700 ERPO petitions filed in Florida in that time period, there was a handful of states that filed 0 petitions. And, I'm sorry, a handful of counties that filed 0 petitions, and some that filed really a lot, a high rate per their population. So it does vary quite a bit. And some of the reasons it varies seems to be familiarity with the law, becoming comfortable knowing when to use it. When it is used, the respondent to the ERPO, the person who is under it, tends to be a white male with an average age of around 40 years old. Now, demographics shift, and when I say tend to be a white male, well over 80% of ERPO respondents are male. It kind of depends on the state. When you look at the whole, it's over 90%. And, the large majority, over 70%, are white. There are, Black and brown people under extreme risk protection orders, of course. In Connecticut, what we see is that the percentage of Black individuals who are under extremist protection orders or risk warrants, you call them in Connecticut, is much lower than the percentage of Black people in the population. So we see some differences per state. We also see differences in age, depending on what the risk is. So the average age across ERPOs is around 40. But when we look at people who've threatened shootings at schools, we see that goes way down to an average age of around 20. ERPO research is done by doing public requests or arrangements with courts and states to get hands on the ERPO case files from the courts. And when we get those ERPO case files, some of which are over 100 pages long, we go through and abstract data from them. So when I present this research, what we're talking about is what we know from the case files. If something is wrong in the case files, then we're wrong about it here. If something is important but not included in the case files, we don't include it here. I was at a meeting last week of ERPO practitioners, people who implement it, and I heard from law enforcement that when it comes to domestic violence cases, they often leave a lot of details out because they know these are public records. So we as researchers won't have that. So I'm just presenting what we have and what we know from the case files, and consider those caveats. When it comes to mental health histories, there are even more caveats to add. What researchers will consider evidence of mental illness in a case file varies. The research that I've done considers evidence of mental illness to be a specific mental health diagnosis listed. So it can't just say they are depressed, right? It has to say they have manic depression or something of that nature, or evidence of having been hospitalized for psychiatric reasons, or that they are on a psychiatric medication. This is not perfect, but the data isn't perfect. So we're trying to be as selective as we can. So we see that there are people who evidenced mental illness or mental health problems in these ERPO case files. 20% in Washington, 40% in California had evidence of a mental health diagnosis. We include here, though it's not quite a mental health diagnosis, there are people who are being put under extremist protection orders due to dementia or other cognitive impairments that make them dangerous to own a gun as well. All of those caveats apply to criminal history as well. We only know what's in the case file. So it looks like a lot of these respondents have criminal histories. And my guess is that this, 21% of ERPO cases in 6 states, those 6 states are California, Colorado, Connecticut, Florida, Maryland, and Washington. That's kind of an at least 21%, because there's probably many people for whom the petitioner just didn't write about a criminal history. But we know that, a good portion of them have a criminal history, including intimate partner violence, including, other violence. Some are nonviolent as well. And we know that up to 10% of respondents had been arrested in the year prior to being served with this ERPO. So many of these people, but maybe not the majority of these people, are criminally involved. The people who are petitioning for these extremist protection orders tend to be police officers. Now, in some states, only police officers can petition, like Florida. Connecticut recently changed its law, but prior to this change, only law enforcement officers could petition. So, all petitions out of Connecticut and Florida, at least until the change in Connecticut, were by law enforcement. There are other states like Michigan and California and Maryland, Colorado, that allow family and household members or healthcare providers to petition for extremist protection orders. And mostly in those states, we don't see any civilians really petitioning at high rates. It tends to be law enforcement officers. And when I say tends to be, I mean like over 90% are law enforcement officers. Maryland and Colorado, however, see something different. Almost 50% of petitions are filed by civilians, and we don't really know what that difference is yet. But even when it isn't filed by a civilian, even when it's filed by a law enforcement officer, in a state that allows civilians to petition, we don't know how many of those were motivated by a civilian, how many, family members called, law enforcement and said, my son is struggling. I'm worried about him. I think he's contemplating hurting himself. What can we do? What can I do to make sure he's safe? And then maybe the law enforcement officer will petition. So we don't know what percentage that is, but these cases have to get to law enforcement officers somehow. So I suspect it's a healthy amount. Why don't we see a lot of civilians petitioning? I didn't mention healthcare workers, but they almost never petition, though they can in a bunch of states now. I think 6 states now. Um, a lot of this has to do with knowledge, particularly on the civilian side. How many people do you know that stay up to date on what state laws are? Not a whole lot. And how many education campaigns have gone on around extremist protection orders to let civilians know what they are, when to use them, how to petition for them? Not really any, right? So people don't know about them. If they do know about them, for example, if a healthcare provider mentions one to a family member, or somebody else mentions it to a family member, they may be hesitant to use it, for pretty good reasons. If we can all think of a gun owner in our lives, probably, that we would be afraid we would really harm the relationship if we used an ERPO. Of course, the flip side is maybe their life would end if we didn't, but it can still be difficult to bridge that gap. The process for filing an ERPO is also complicated, right? It's a court process, and most of us don't do anything with court processes. So knowing what the statutory standards are for an extremist protection order is not something a lot of people they're not going to know it. And knowing what counts as evidence and how best to present that evidence is not really something that civilians are trained in. So it can be difficult to figure out how to do this. Healthcare workers, as I mentioned, are generally not filing extremist protection orders. We don't know the extent to which maybe they're reaching out to law enforcement to alert them to a case that they think is dangerous. But when asked, why aren't you filing these? What's happening? They've often cited a lack of time. And think about the amount of time you spend with a healthcare provider on a visit. It is not long. So they are, trying to assess a whole lot of different things and trying to do a whole lot of different things. And, adding an extremist protection order to that can be complicated, especially when that will result in a court hearing that they are required to be at, or the extremist protection order case is just dismissed. So telling a physician, who has clinic on Friday, that you have to be at the court at 2 p.m. and your case is going to be heard probably somewhere between 2 p.m. and 6 p.m. means that they have to start rearranging their entire patient schedule, which is really difficult, and patients hate it. So there are some barriers, and we could talk about ways to overcome those. Law enforcement, however, report that, once they became familiar with and trained on, then, they support ERPOs and have used ERPOs and have seen the benefit of using ERPOs, have seen instances where people are safer. The situation is safer because a gun is removed, or guns plural. Now, I mentioned at the beginning, there are many types of risk that extreme risk protection orders can be used for. Often, suicide is a risk or a concern that people report on these extremist protection order petitions. It varies by state. Connecticut, Indiana, and Oregon are listed here. The majority of those list a risk of self-harm. Interpersonal violence risk also varies by state. And a lot of petitions list both. We tend to think of risk of harm to self and risk of harm to others as these very separate things, and we silo what research we're doing. And I'm guilty of this too. I study interpersonal violence. I don't study self-harm, but a lot of times these are the same people, engaging in interpersonal violence and also at risk of self-harm. So we're seeing that come out in these extremist protection order petitions. And in that 6-state study I mentioned, we looked at whether cases were filed in response to threats to shoot and kill 3 people. We determined this to be our kind of mass shooting threshold, even though a mass shooting is defined as 4 or more people killed in a shooting event. We found that 10% of the case files were in response to threats to shoot and kill 3 or more people. Now, why did we use 3 or more instead of 4 or more? It's because of the way people talk. When using the 4 or more definition, you have bodies to count. People don't talk like that. They don't say, I'm going to shoot you and your family members, which number 3. So we know that that's 4 people, right? They say, I'm going to shoot you and your family. And because they said family, we're comfortable making the assumption that there's at least 2 people in the family, or they would say you and your mom. That is an assumption. We also made an assumption that public places would have 3 or more people in them. So if somebody says they want to shoot up a grocery store or a restaurant or someplace like that, we made the assumption that at least 3 people would be present. So 10% is, I think, pretty high for this type of mass violence. We've also looked, I and other researchers have looked at police actions in association with that moment in which it's decided that an ERPO petition needs to be filed. We call this the precipitating event. And the precipitating event is kind of you can think of it as the straw that broke the camel's back, but it's the event to which law enforcement are called or a civilian petitioner decides, I have to file this extreme risk protection order petition. This is why, because tonight they threatened to shoot themselves and they barricaded themselves in their room. Or, it's a domestic violence situation, and I was, really injured and I called the police and the police came. So what we know is that sometimes, in addition to petitioning for an extreme risk protection order, there's an arrest or law enforcement takes someone in for a mental health evaluation. Both of these can occur. Neither of these can occur. One or the other can occur. In Marion County, Indiana, many people, 75% of the respondents were involuntarily transported for a psychiatric evaluation. And remember that in Marion County, 60% of the cases were for suicide risk. So, it's possible that virtually all of the suicide risk cases were taken for a psychiatric evaluation, and then some of the interpersonal violence cases as well. And only 8% of respondents were arrested. And that also kind of tracks because you don't generally arrest someone for suicide risk. In Connecticut, from 2013 to June 2020, 19% of people were arrested at the scene of that precipitating event that led to the ERPO petition. 70% were transported to the emergency department for a mental health evaluation. and 8% were both arrested and transported to the emergency department for a mental health evaluation. We can also talk about court outcomes. What we're seeing is that generally the courts are granting these petitions. Each state has its statutory standards that judges have to live by, including evidentiary standards. And looking through this evidence, looking through, what's presented to them and looking at the statute, the large majority are being granted. And generally, it's over 90% are granted at the ex parte stage. You're in Connecticut, your ex parte stage is a little bit different because if the court doesn't agree, then there's no record of it. So we don't know how many, the court doesn't agree with. But generally, in states that have this distinct ex parte stage, over 90% of the petitions are being granted. And, it's a little less at that full hearing stage, but it's still the large majority at the full hearing stage. Now, we don't have a lot of information on racial splits or gender splits or, anything like that, that we would be able to say, oh, they're being granted for, in a biased way. We don't have that yet. So we don't really know what is happening there. We do know they're being granted, and that tends to alleviate some concern that some people had that that the petitions would be bogus, essentially, that people would willy-nilly file petitions against people they were angry with, wanted to get back at. And a lot of these concerns were around intimate partners, and what I call the myth of the vengeful woman, that women are just, these really vindictive creatures who are going to file all these court processes to get back at intimate partners who have wronged them. We don't see that. We don't see that in domestic violence restraining orders. We don't see that in extremist protection orders. So, it looks like these are being used as intended. Here's a little bit about outcomes. So a couple studies have looked at whether firearm suicide and total suicide changed after an ERPA law was passed. So these are just ecological studies. Connecticut and Indiana are state level studies. San Diego is one city. Actually, I think it was the county. And the Connecticut and Indiana studies showed a decrease in firearm suicide in response to the extremist protection order law being passed. Indiana, they saw a decrease in total suicide. Total suicide didn't change much in Connecticut. In San Diego, they didn't see any significant differences in firearm suicide. They didn't test total suicide, but it's one county. And so I don't know how much of an effect they were really going to be able to see. There have also been some counterfactual studies on ERPOs and suicide risk. And what I mean by counterfactual is that they created a counterfactual, a fake population. Basically, what they did was look at death certificates for people who were under ERPOs, saw how many died by suicide and what types of suicides, took the case fatality rate for that method of suicide, and imagined this many suicide attempts. So if 9 people died by firearm suicide, we know that 9 out of 10 people who attempt firearm suicide die. They would make the assumption that there were 10 attempts, and then use the probability that someone would use a gun in a suicide attempt to create this counterfactual population, which is all very mathy. And I'm always a little bit uncomfortable with, counterfactual creations, but 3 studies now have found remarkably similar results using different populations. And that is starting to get quite convincing. So one in the original study, one firearm suicide was estimated to be prevented for every 10 to 20 firearm removals. And then updated studies have found that it's 17 to 23 extremist protection orders needed to avert one firearm suicide. And when you limit to IRPA petitions that included some suicide risk, because not all do, it's every 13 to 18 IRPA petitions needed to be put in place to avert one suicide. So to wrap up, there are a lot of policy and practice implications, from this research. States are varying in their IRPA laws, in how they're implementing them, and how each county is using them. So there is really a lot of opportunity to increase the use of extremist protection orders in appropriate circumstances and potentially save more lives. We also know that civilians aren't really petitioning. There is some limited research that suggests that when civilians petition, they are less likely to have the petitions granted than law enforcement. So they might benefit from some support in filing that petition, like we do with people filling out domestic violence restraining orders. There are advocates that help them. There are lots of opportunities for education and training of authorized petitioner groups and court officials. They need to know when to use IRPO, how to use IRPO, what the law is around IRPO. We also need to look at wraparound services. You didn't hear me say anything about, and then this percent went on to get mental health care if they needed it, or, this percent started working with a social worker or anything like that. Because, that's not in the case files, number one. And number two, the IRPO law is only about gun removal. It is both a good thing, it's a very focused law, and a bad thing. People need more than that. So wraparound services, will be beneficial. Um, and what we know from the places that are doing IRPO is that there are people spearheading these efforts. There are people championing these efforts, creating protocols for implementation, and the like. So with that, I will stop. I think that's right about 35 minutes.
You did great. Yeah,
Sorry.
very great. Thank you. Just there was one question in the chat. Would a therapist be considered a healthcare worker? I said that varies by state. I put in Connecticut's definition of what a medical professional might be. And I also put for anybody that's interested a link to Johns Hopkins state by state IRPO resource center. So that's there for anyone. But if anyone has a question about that or something else, or a discussion point, we're happy to sort of open it up. Just come on, unmute yourself. It's pretty informal. Oh, that's perfect. Now I can see you all better.
Yeah.
Like the Little Red Riding Hood, better to see you with.
I'm pretty friendly, so.
It's true. She is. So I'll ask a question, and then we'll go right to Jen. If there was like one thing you could tell states to do that would help implement IRPOs, like what would be your first thing that you would advise a state policymaker to consider to improve IRPO implementation?
That's big.
But just one thing, you can only have one thing. So that's what makes it small.
Well, but it's the differences between states, right? I know what I would tell Michigan. It's not what I would tell Maryland, right?
It could be something that the state has already done. Like maybe a state has already done the thing that you think is really important for, so not like the next thing for every state, but if a state has sort of one foundational thing in place to make IRPOs successful, what do you think it is?
So I actually think that a lot of IRPO success lies at the local level. So I would tell the state to put in the policy that each jurisdiction, each law enforcement agency and court system, court jurisdiction needs to create a protocol and a policy for how ERPOs are implemented. Um, I'm not going to out any jurisdiction, but some have very, very detailed policies. So everybody knows what they're supposed to do. For example, there's a jurisdiction where anybody can petition for ERPOs who's law enforcement. So a line officer, a detective, whomever. But that petition is going to go through several set of eyes within the county before it's actually submitted. So it's going to go to the duty officer, and then it's going to go up to, whomever else. And then if, those people within law enforcement think this is an appropriate case, then it's going to go to the department attorney, who's going to look at it and see if it's an appropriate case. And then it's going to go to the court. And, they know exactly, who is going to attend that court hearing. They know how to serve the extremist protection order. They have a process for removing the guns. Everything is really detailed and laid out so that everybody knows what their responsibility is and how to do it. There's another jurisdiction that said we need help with their implementation. And I asked about their protocol, and they don't even have one. So, that's going to be difficult because nobody's going to know what their responsibilities are, or what they're authorized to do, or how to do it. So I'm not surprised they need help with implementation. So I would say require every county, or however they break up the jurisdictions. I know it's different in Connecticut, to have a protocol that they need to submit, and it's, kept track of, have some accountability.
Thank you. Jen?
Sure. My question is on a similar track, but not the same. You talked about the variance in implementation, both across states and within states. So when you started talking across states, I thought of like the differences across states, right? And I guess within states, there could be differences within jurisdictions, both in policy, but also clearly now in like implementation process and procedure and all of that. But I was also wondering if you've seen anything related to the complexity of the law and implementation, right? There's, or I'm sorry, not implementation, but the petitioning complexity. So there's the actual implementation on the ground, but there seems to be also a variety of just petition steps and procedures by state. And I don't know if you've noticed anything in terms of relationships between that and petition rates.
So I haven't noticed, differences, but you're right. The petitions across states differ greatly, and some states don't have a state petition. So in Florida, the petition can differ by county. And they're mostly using the same one, but some counties are using a very different one. I think that as long as everybody understands their petition, it can work. And so this next statement is really about self-interest. I want a petition that I can get data from, good data from. And, we're going to develop a model petition, and who knows if anybody will use it. But, hopefully we'll see some pickup. In general, I do think that petitions that clearly walk you through the process are better. So what I mean by that is that generally there'll be a checklist of the criteria that are laid out in the law for an extremist protection order. So if your law says that one of the things they're going to look at is harm to animals, then there'll be a harm to animals item that you can check or not check. And what you're supposed to do in all of these petitions across all states is then provide evidence of everything you checked. And some of the petitions don't really look like they have space for that, which law enforcement officers are going to be used to. They're going to be used to writing affidavits and their narratives and submitting it. But civilian petitioners may not understand or know, or, may turn in a handwritten piece of paper because that's what they do. And when I say that, I'm saying that because I've seen cases where there's been a handwritten piece of paper. So
Yeah, so sure. So it sounds like implementation, regardless of the complexity of the law, seems to have, okay. Yeah.
Other questions? So I've got 10. Oh, Jillian, and then I've got 10, so I'm like ready.
Okay. So this is just a very basic question that might be obvious, but when you file an extreme risk protection order, who decides how long it is valid for, or like how do you get out of because people who are suicidal might not always be suicidal. So, and there's people who can help evaluate that, and I'm just wondering like how they're involved.
that's actually a great question. And it's going to take me a little bit to answer it because there's a lot going on there. So I mentioned that, there's often an ex parte order and a full order. So the ex parte order is one that a judge evaluates. The respondent to the order isn't a part of that. And the judge decides whether to grant this ex parte order. The ex parte order tends to be really short. For example, in Florida, it's not more than 14 days. And I can tell you in Florida, they all make it happen that there's going to be another court hearing on it, within that 14 days. They're really careful about this. So that first one will expire after 14 days. The full order, which is granted or not after a hearing that the respondent had the opportunity to attend, that the length of that depends on state law. So in Illinois, it's up to 6 months. In California, I believe it's up to 5 years now. In most states, it's a year. And there are 2 states, I actually think yours might be one of them, and New Jersey, which have suddenly left it open-ended, for judges to determine. But you're right, risk doesn't persist your entire life, thank goodness. And sometimes what that looks like is that the full order, so after those 2 or 3 weeks, whatever the process is in that state, it may not turn into a full order. Maybe that 2 weeks was all that was needed. So when we look at whether an ex parte order turned into a full order, some people want to interpret that as whether it was real. So if an ex parte order doesn't turn into a full order, they might say, see, that's evidence that this was a bogus case. Once the respondent showed up and said what they had to say, and there's often a higher standard of evidence for the full order since it's longer, that's clearly a bogus case. But what it could be is that the crisis has been averted. Something has happened. There isn't that level of danger anymore. And we can't be quick to say one way or the other until we really have evidence on that. So once the full order goes into place, there's a process for appealing it, essentially asking for it to be removed. And, you would file a motion to rescind. The court would decide whether to hear the motion and then, decide from there. In many states, you have one opportunity during the year the extremist protection order is in place, if it's a year, to file a motion to rescind. So you can't file it every week until you get it, right? In Michigan, our full order is a year, and you can file once during the first 6 months and once during the second 6 months. So it depends on the state.
Yeah, and I can confirm both Connecticut and New Jersey are the states that are open until terminated by the court. So it's whatever the court deems as being appropriate after hearing.
Yeah.
Okay, so other questions before I ask my other question? So as part of BISCA, which is the Bipartisan Safer Communities Act, this was for those who aren't like totally immersed in this was the federal law passed at the federal level after the Uvalde shooting. And one of the things that it did was increased a lot of funding for OPCOs, for other implementations, for mental health, et cetera. How do we see states using that? I know, more states have tapped into BISCA funding than have ERPO. So what are states doing to, right in the map, there are a whole bunch of states that don't have ERPOs, but more states are taking advantage of the BISCA funding to help do other things. So what are states looking at as an alternative to ERPOs if that doesn't seem like the right policy fit for their state? If you know. I'm sorry. I 100% appreciate that's outside of the scope of the state of science on ERPOs.
I know a little bit.
I knew you would.
So it's not across the board, but I do know that community violence prevention interventions have been funded, as have things like more mental health counselors in schools, or resource officers in schools. Some of the things that have been funded are things that we don't actually have a lot of great evidence for, which is always, disappointing. And when I say not a lot of great evidence for, I mean, not because it hasn't been studied yet, but because the evidence has, shown that it doesn't look like it really works. But, some of the things we do have good evidence for. And in states that have ERPO, not all of the money is going to ERPO. Some of it is going to those, more school-based efforts and community violence efforts. So it really runs the gamut.
Are there any other questions? I promise I'm not going to force us all to stay here, but we have about 5 more minutes. If there are any other questions or concluding thoughts? Okay, well, thank you very much, April, for coming and sharing. This will be available. We did record this presentation. We will email it out to you all and to folks who, RSVP'd that maybe weren't able to attend. So we'll circulate it. It will also live on our website. And the event that you lose your emails, I lose mine all the time. If you email me, you know that. And so that is where it will live. But please join me in thanking Dr. Zeoli for her time and her knowledge today. I appreciate it.
Thank you for inviting me.
Yeah, of course.